Hello, this is the Birth Words Podcast, episode number 9. In this episode, I'll be talking about beliefs and assumptions that people have about birth and how they play out in conversations and interactions during birth.
You're listening to the Birth Words Podcast. Utah-based birth doula and applied linguistics scholar Sara digs into the language of pregnancy and birth to help expectant women claim their power as life-giving agents engaged in a praiseworthy work. This podcast aims to promote positive birth paradigms and is not intended as medical advice.
Hi, and welcome to episode number 9. Today we're going to talk about the complexities of communication and how the underlying beliefs and assumptions that people have come into play when we communicate. Of course, since this is the Birth Words Podcast, my lens will be looking at pregnancy, birth, and the postpartum period, but as you listen, I invite you to consider how the principles that we're talking about today apply to pretty much any verbal interaction and nonverbal interaction that you have in various realms. So, I came to this idea that I'm going to discuss with you today through some research I've been doing, reviewing birth stories. I've been looking closely at 15 different birth stories that were published online. And the reason there are 15 is that I selected 5 different websites that are common repositories of birth stories. From each website, I've selected one story that has an overwhelmingly positive tone, one story that has an overwhelmingly negative tone, and one story in which the tone shifts, either from positive to negative or negative to positive. And I've been looking closely at these stories and at all of the utterances, that's the word we use in linguistics to mean things that are said, as these stories are told. The interesting thing about a birth story is that it's not an accurate representation of what was actually said during an interaction. Many of them are written weeks, months, and sometimes even years after the fact. And most people didn't have a tape recorder going at their birth. I don't know if tape recorders are even around in 2019, but most people are not quoting verbatim the words that were used during a birth experience, but they are recording what was remembered, which I hypothesize is more the underlying belief and assumption that was communicated through the verbal interaction. So as I studied these stories, I divided these underlying beliefs and assumptions. They seem to sort of naturally fall into these 4 piles. As I looked at each utterance, each thing that was said during the story that was being told, there were underlying beliefs or assumptions relating to each statement in these 4 categories. 1, beliefs about birth, generally, the process, the experience. 2, beliefs about medical interventions during birth. And there's a wide range of beliefs about the role that medical interventions should and do play during birth. 3, beliefs about the birth giver's role as a birth giver. And this explores things like her ability to give birth, and especially unassisted by medical interventions. Obviously now we're kind of crossing back into the other one, but beliefs about the birth giver and her ability and performance. The 4th category is beliefs about authority figures in birth. And this questions both who is the authority figure, is there one, are there many, and if someone is acting in a position as authority figure, what then is their role as an authority figure? So, as I indicated when I was just laying out those categories, there's a lot of interplay between them, and normally one utterance does not convey only one assumption or belief, but often many. So here are some examples from some of the stories that I looked at. So in one story, a nurse says to the birth giver, "What exactly is your plan for coping?" If we look underneath this phrase, this question, there are a couple of underlying assumptions that I pulled out. I'm sure you can also hear others, and I'd be interested to hear your thoughts as well. Feel free to email me at birthwordspodcast@gmail.com or contact me through my website, summitbirthutah.com/birthwords, if you have thoughts you'd like to share. But as I looked at this utterance, what exactly is your plan for coping? I heard the underlying belief that birth is painful or overwhelming, that there's a need to cope, and 2, that birth requires preparation. She indicated that a plan should be in place for this. And as we unpack these, I'm not going to assess, I'm not going to put any values, judging of good or bad. I'm just going to kind of unpack what the underlying assumptions are. And we'll use these tools in future episodes as we dig more into this, but we're just laying some groundwork for identifying the underlying beliefs and assumptions that go along with an utterance. So another one, a midwife says to the birth giver, whose name was Bethany, "Okay, Bethany, listen, we need to get the body out now." The head of the baby had been born. So, "Okay, Bethany, listen, we need to get the body out now. Don't worry about contractions, just push as hard as you possibly can." Now, this utterance, I feel, communicated a few underlying beliefs. One is the midwife was positioned as an authority figure in this utterance. However, she as an authority figure was also communicating that she believed the birth giver was capable and strong, able to follow her directions to push as hard as she possibly can and birth the body of the baby without the intervention of the midwife. And then the third underlying belief or assumption is that birth can be risky. All right. Here is another example. The husband of one woman said to her right after the baby was born, I think this was Bethany as well, "I'm so proud of you." I hear in that statement an underlying assumption that birth is hard work, that she worked hard and there's something to be truly proud of. In another story, the doctor said after the birth of the baby, "I think every baby should be welcomed into the world with music. It should be a celebration." And in this utterance, I hear that birth is a family or social experience, one, and that another is that birth is rewarding, something to be celebrated. Flipping to another utterance, at one point a nurse said during one of the stories, "Your doctor has said that you couldn't possibly be in active labor yet. He said to send you home to wait a little longer." And in this I hear several underlying beliefs, one of which is the doctor as an authority figure making this call about whether or not she could possibly be in active labor. And another belief that I hear is that birth proceeds according to norms. All right. Again, there's a lot more we could do with this, but we're just kind of doing first level unpacking of beliefs. Here's another one. A nurse said to a woman who had been planning a cesarean birth for her baby because of some anxiety and worries that she had, a nurse said to her, "You're a textbook case of how we wish every woman labored. Are you sure you don't want to try vaginal delivery?" And in this, I hear a few underlying beliefs. One is that birth proceeds according to norms. You're a textbook case. In the textbook, these norms are laid out. But also the counter belief that it doesn't always proceed according to these norms that have been laid out. So that's interesting. Another is a belief that the birth giver is strong and capable. We wish every woman labored like you. Are you sure you don't want a vaginal delivery? They're directing confidence at her and her ability to birth. And then another belief that birth is manageable, that this woman was perhaps feeling that it was unmanageable and was opting instead for a cesarean. The nurse was conveying a contrasting belief that birth was in fact manageable. Okay, this is fun. I could do this all day, but I'm going to just wrap up with one last statement from a birth story. And then we'll wrap up for this episode today and come back to this fun exercise another time. In another instance, a midwife says, in an uncomplicated delivery of a baby, "Yes, baby is right here. Push when you are ready." You notice as the midwife says, "Baby is right here. Push when you are ready," that she is communicating that birth proceeds according to norms. She's also communicating that the birth giver is an authority figure, choosing when to push, as the midwife says, when you are ready. You can also see that she is using her authority as the midwife. Giving direction is certainly an act that authority figures do, but as she gives that direction, she uses it to help the birth giver step into her authority and push when she is ready. So, interesting. I hope that this was a fun little teaser for you. We'll come back to this idea, to this exercise throughout other episodes, but I've noticed that many times when a woman has a disempowering birth experience or doesn't feel cared for or listened to, it's because there's disharmony between her underlying beliefs and assumptions about birth and those of her care provider. And sometimes it's because she's not in touch with what her own beliefs are about birth or about medical interventions or about the roles of authority figures, and only discovers her own beliefs when she's faced with something that runs counter to them. So I think that it's important to consider as birth givers, as those who support birth givers, what are my underlying beliefs and assumptions? What are the birth giver's underlying beliefs and assumptions? Do they align? If so, how can I use that to make this a positive and empowering experience for this mother? Or as a birth giver, how can I use my interactions with others to help me have a positive and empowering experience? If they don't align, is it because someone's ought to change? Is it because there's just a mismatch and another care provider would be a better fit? Is there reason to alter the way that we communicate when we sense that somebody's coming from a different underlying belief or assumption in their communication? So I hope that this was as fun for you as it was for me to just think about how when we communicate, we're saying so much more than just the words that we're saying, and that our beliefs and our assumptions are colored by our experiences and our perspectives, and that the communication is complex. All of these factors come into play. So I look forward to continuing to dig into some of these interesting complexities in future episodes. Thank you for listening. Bye.
Did words play an important role in your birth experience? If you're interested in sharing your story on the podcast, go to summitbirthutah.com/birthwords. If you're liking what you hear on the podcast, please leave a review on Apple Podcasts, Google Podcasts, or wherever you choose to listen. For more resources about harnessing the power of words to benefit the birth experience, visit summitbirthutah.com/birthwords.